Hi, I'm Terry Schroeder. I'm the Program Director for Student Services for the Okaloosa County School District.
Hi, I'm Carl Schroeder. I'm Assistant Principal at Destin Middle School. This is my 35th year working with children, and we're excited to be doing this presentation for you.
So today we're going to talk to you about a topic that's very near and dear to both of us. We're going to talk about trauma-informed care. First of all, we want to give credit where credit is due. This program is brought to you by SEDNet, which is a multidisciplinary network for students with emotional behavioral disabilities. This network works with different agencies throughout the state to help provide quality care for children who are at risk for emotional behavioral disabilities. So when you think of the term trauma, it brings a lot of different thoughts to different people's minds. Trauma, in the medical standpoint, could be an injury that's caused from an outside source. Well, today we're going to talk about trauma in terms of what happens to children and adults as well that are experiencing different types of insults to their own life experience. So as we go through this topic, we want you to keep in mind this essential question. How can the knowledge of trauma improve student outcomes? So keep that in the back of your mind as we go through our discussion today. We're going to start off with something that's probably going to be a little difficult to hear, but we want you to really get wrapped around in your mind what is the experience in some of our children that come to us on a day-to-day basis outside of school. We're going to talk about, or we're going to listen to an actual 911 call for a little girl named Lisa.
On the 21st, 1991, time 22:13 hours. This will be a 911 call, position CT07.
Standing emergency. Standing emergency.
My mom and Daddy are having a fight.
Is she getting hurt?
Stop it! Send the police, please.
Okay, we're going to be there. We'll take care of you. Let me talk to you. Where's your mom? Are they
What?
fighting on you? What's going on?
They're having a fight because this is bingo forever and ever. They always have this because he has a cousin. He's always drinking beer and getting drunk. And Mom.
What's his name? What is his name? Your father's name?
He's my stepfather.
Okay, how old is he?
Stop it! Don't yell at me!
What's going on? Lisa? Lisa? Fighting on you. What's going on?
Hurry, Mommy.
How's he hurting her?
He made his mommy.
Okay, don't cry. We're going to send the police.
Okay.
Okay, now where's your mother at right now?
She's in the room fighting with them. Okay, could you just send the police?
Yeah, they're on their way, but I'm going to keep you on the line until they get there, okay? Is your front door open?
Oh, no.
Okay, you go and lock it and come back to the phone so the officers can get in?
This way.
Okay.
He just knocked my sister out.
What sister that he knocked out?
My little sister.
You're
The
doing...
4-year. Oh, my God.
What's the matter?
Nothing happened. Just wait for the police. Wait, I want to go see what happened, please.
Okay, the police are on their way, okay? Hello? Lisa? The police are on their way, okay?
Mama, the police are coming. My stepdaddy's got the baby now.
Yeah, Lisa, where is he at now?
What?
Lisa, where? Hello?
So after hearing that and thinking about what Lisa and her family have been through, Lisa shows up at your school the next day. Do you think Lisa is really concerned about remembering to put her backpack up? Do you think Lisa really has the mindset to understand where her supplies are? we have to understand as educators and as folks that deal with children every day that we oftentimes don't know what's going on in the life of those children and at home. Let's think about another situation. I'm going to show you another video that really includes adults and your colleagues as well. So what's the answer to that question? Would it make a difference if you could see into what was really going on in people's lives? Would it impact how you interacted with them on a day-to-day basis? I think it would. I think it would. And so this presentation is to really help you understand the importance of seeing beyond what's right in front of you and try to understand what's going on in the background. So let's start with this picture. We see a picture, a mom and a dad and two little kids. When you see that, what kind of words or what kind of experiences come to your mind about how these kids experience school? They probably feel safe and secure. They seem to be feeling supported. They probably have the ability to regulate their emotions because of the support that they're experiencing from their family. I suspect that they probably experienced academic success, and if they didn't, I bet these two parents would probably intervene on their behalf in some way. I would think that they would probably have a positive self-esteem. They seem to have good interactions with each other and their family. I bet that they're goal-oriented. They probably have hopes and dreams. Now let's look at this picture. What does this young man experience when he goes to school? I would venture to guess that he probably doesn't feel secure. He probably has insecurity. He may feel uncertain. He probably feels a little bit nervous and possibly even scared. From what's going on in the background, he probably doesn't have a real good example of how to regulate his emotions, considering that he's got fighting parents in the background. He may have a poor self-esteem. I bet he's going to struggle in school a little more than the children in the other picture. He might have a feeling of helplessness, maybe even hopelessness. This is one of my favorite memes, I guess you would call it. Students who are loved at home, they come to school to learn. And students who aren't, they come to school to be loved. We have to recognize that as educators and as people who deal with children on a day-to-day basis. Sometimes these kids are going to come to school and they're not experiencing the love that they really need at home. And they're going to want that from us. So let's jump right into trauma. 1 in every 4 children attending our schools have been exposed to a traumatic event that can affect their learning and or their behavior. In Okaloosa County, we currently have 32,026 students. If the statistics hold true at 1 in 4, then of those 32,026 students, 8,006 of those students have experienced some type of traumatic event. Statistics also tell us that 25% of those kids are going to experience some type of serious mental health issue by the time they're 18. So that number would be 2,002. Of those 32,026 students would experience some type of serious mental issue before the age of 18. That's a lot of kids. 538 of our children are homeless, and 226 of our children at the start of the 2020 school year were in the foster system. That number only gets higher throughout the year, so I'm sure that number is at least a little bit higher at this point at the end of the 2021 school year. So let's define trauma. Trauma is any stressful event that is prolonged, overwhelming, and unpredictable. Now let's state for the record right here, we don't get to define each other's trauma. What might be trauma for me might be different for another person. But in overall generalized definition, trauma can be anything from accidents, physical, sexual, or emotional abuse, neglect, foster care, adoption, loss, and loss can be anything from a beloved pet for a child who is already experiencing an unstable home life. It could be the loss of a caregiver. It could be the loss of a relationship. So any type of loss for somebody could be a trauma. Natural disasters. We live in Florida. Hurricane Alley right here. So we have children that are affected by that year in and year out. Think about what happened a couple of years ago with Hurricane Michael to our neighbors over to the east. Our district was highly impacted by homeless students that became homeless as a result of Hurricane Michael. So natural disasters is considered a trauma. Frequent moves. In our area, we have military on all sides of us. So those students are impacted by frequent moves. Or think about deployments of their parents, mothers and fathers that are serving our country and they get moved or they are deployed. Bullying is also a stressful event. Loss of a caregiver. This one's important because one of the things that we are seeing in this day and age is we are seeing a lot of parents or grandparents, and great grandparents raising children. So the possibility of losing a grandparent or a great grandparent who are raising our students is higher for some of these children. So that's a big deal for them. Domestic violence and witnessing violence. So any of these things can be considered a traumatic event. And again, every person experiences these types of events differently. So we have to be very careful that we don't downplay somebody else's experience and say, well, that's not a trauma, because to them it could possibly be a trauma. I have an example of perhaps you have a sibling group that has a beloved pet in their home, and because of domestic violence, they're removed from that home. However, the pet can't go with them. That's actually happened. And so when they're removed from the home, their pet is still in that environment. And for those children, that's a trauma. That could be something that really impacts them on top of the fact that they've been removed from their home. So trauma-informed care is what we call a compassionate approach to engaging people, our colleagues, and children, our students, who have histories of trauma. And it recognizes the presence of trauma and acknowledges the role that trauma has played in their lives. So really it's just approaching people in a way that we try to understand that they've been exposed or have a history of a traumatic event. What makes an event traumatic? Well, it's sudden, it's unexpected, and it can be extreme. It usually involves physical harm or perceived life threat, but it doesn't always have to. Again, we have to be careful how we judge another person's trauma. People will experience these events out of their control. And then certain stages of life make people or children more vulnerable to the effects of trauma. And if we look here, childhood, that's most of our students. Teens, that's the rest of our students. And then the early 20s. These are those students who have just left us. So in this next video, this is Dr. Burke. She is a pediatrician that has done a lot of research on trauma and the effects of trauma on the child's brain.
But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, Dr. Burke, have you seen this? In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand, better than we ever have before, how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed.
So Dr. Burke mentioned in her TED Talk there about the ACEs study. And so what I want to share with you is some of the questions, actually all of the questions, there are 10 of them, that were asked of adults about their childhood. And I've kind of put them together here. And notice there's a one beside each one of the questions. So each one of these questions, if you answer yes to this question, then you get a point on your ACEs score. So let's start with the first one. Did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid of being physically hurt? If you answer yes to that question, that's a point on your ACEs score. Did an adult in your household or a parent push, grab, slap, or throw something at you or ever hit you so hard that you had marks or were injured? Again, if you answer yes to that question about your childhood, that's another point on your ACEs score. And it goes on and asks 10 questions. And you can see the rest of them there. It talks about any type of sexual activity as a child. Did you often feel that no one in your family cared about you or loved you? Did you often feel that you didn't have enough to eat, or you had to wear dirty clothes, or you had no one to protect you? Or were your parents too drunk or high to take you to the doctor if you needed it? Again, any yeses adds another point to your ACEs score. Here's a big one. Were your parents ever separated or divorced? Many people can answer yes to that one. Was your mother or stepmother ever abused, pushed, grabbed, slapped, anything like that? And again, you can go on and you can see the questions that are asked there. Was a household member depressed or mentally ill, or did a household member ever attempt suicide? Or did a household member ever go to prison? So what does all this mean? Well, as Dr. Burke shared, as you add up the yeses, that's what we call the ACE score. So an ACE score of 4, that means you only had 4 yeses to those 10 questions or more. Here's what the statistics say. 2 times more likely to be diagnosed with cancer. 4 times more likely to suffer from emphysema. 6 times more likely to have had sex before the age of 15. 7 times more likely to be alcoholics. Here's where it hits us in education right in the face. 32 times more likely to have a learning or behavior problem. And for public health, this is a big deal. More likely to have a shortened life expectancy by up to 20 years. That's 20 years off of your life. That's a big deal when it comes to public health, because the life expectancy now is in the mid to upper 70s, and you take 20 years off of that, and I don't know about you, but that's close to where I'm at right now. So that's a pretty big deal. So that's how the ACEs score plays a role in what we now know about childhood adversity. So at this time, I'm going to turn this over to Mr. Schroeder, and he's going to talk to you a little more specifically about what Dr. Burke talked about in the fight or flight or freeze response.
Hi, this is a perfect segue for me because I work at the school base, and one of my primary jobs is discipline. So all the students that are having these struggles, they get to come to my office and I get to see them personally. So I'm going to share some of the experiences that I have with those children in my office and some ways that we can help them out to prevent them from ever getting there. So the first thing we need to know and understand about is the physiological and the psychological effects of trauma on the body and how children react. I think one of the biggest things I can start out with before I go into these slides is that every child is different. We can't come into school with a predetermination on how well children should act. Like if it was my child, they should act like this. If they're so-and-so's child, they should act like that. We have to be open-minded and take the children as they come to us, because guess what? Parents send all their children to us. So we get to see all the children. So the children react in 3 different ways: fight, flight, or paralyzation. I didn't know if you knew about the middle one. There's sometimes when a child, as you're getting on a child, maybe he's done something wrong there or she's done something wrong, and they don't even respond. So that is one of them. Or maybe they're going to talk back, or maybe they want to run away and they want to avoid the whole conversation. So that's the 3 major ways that children interact with you if they've had trauma. So what happens in the fight or flight? Well, the first thing that happens physiologically is that the nerve cells fire and you start getting this chemical called adrenaline. If you've ever known that in the middle of a night you've got up and something spooked you and your blood pressure goes up and your heart rates go up and it's pounding, that's what a lot of children feel like when you've approached them and they think they've done something wrong, and maybe you're getting on to them with that bad tone or your face or your demeanor. As you can see, my beautiful demeanor compared to Miss Schroeder, I have to be very careful on how I approach children because I kind of have that look already of a little bit of the authoritarian. So I have to walk up with a smile on my face, and I go and I investigate and see what's happening. The next thing is the respiratory rate is increased, the heart rate is faster, blood pressure rushes to the muscles, awareness intensifies, they start looking around. Their impulses quicken, the perception of pain diminishes, and they're looking for the enemy. Now, as I'm approaching that child, or a teacher's approaching that child, you may be the enemy. You don't know what happened to them at home that day. As you recall that 911 call, they may have just gotten off the bus, and you're getting on to them about something. How do you get on to them? How do you relate to them to help nullify this fight or flight? That's the big reason what we're going to be doing today is trying to help you be able to deal with that. So here's what really happens. And I taught anatomy and physiology for 25 years, and it's very interesting how the brain works. The front part of your brain is your thinking part of your brain. When you have a fight or flight reaction, the front part of your brain shuts down. That means the kid is not thinking. We think that sometimes all the time with some teenagers. But when they're getting a fight and flight situation, their brain doesn't react. So you're asking them questions. If you're asking questions at rapid fire and they're just giving you that blank look, it's because their brain's shut off. They're not thinking anymore. So you got to give them a minute to kind of get their thoughts together. Just relax. Give them a minute. Let them talk. The next thing is they overreact. Someone knocked me out, someone hit me, sometimes they just got touched. So you have to kind of decipher what they're really saying. Maybe their thinking's distorted. I had a student one time thinking someone was following them all around the school, and I had to show them a video and say, there's no one following you, but they really, really thought someone was following them. I mean, honestly, they did think that. Their focus narrows to only the things that they can cause them harm, so they kind of stay locked on one purpose. They can't think about the whole situation. Fear becomes the lens through which they see their surroundings. Survival is the only thing that they see. So as you're thinking and talking to children, kind of keep these things in mind. This is what's going on in their brain. And it's not how we want them to react, it's how they are reacting. We need to adapt how we react to them. On this picture, if you look at this picture, and I've seen many of our adults and children, they react so well to students that have something like this happen. You can see this young person here has a broken leg. They're on crutches. If I were to ask you, what are you going to do or what should you do for this child, especially like getting on the bus. Our bus drivers are our number one line that sees our children. They're number one. I think they're probably, I'd hate to say this, but the most important people that we have is our bus drivers because they see the children first. As they get on the bus, what would you do? You'd probably try to help them on the bus, give them preferential seating. You'd probably give them a buddy to sit with. So you'd make all these adjustments for this child. You may even say, hey, you need to put your leg up on the seat. We'd make these adjustments. Okay? What would you do for this person? See, this person is having an injury, but the injury is to their brain. The trauma has caused injury to their brain. How do we react to them? Send them to the office, of course. No, we need to try to prevent this triggering and help this children also and make some adaptations for this child so they can function through the day just like the child with crutches. Interventions to the meltdown. Now, once the meltdown's happened, we're in it. There's really no going back at that time. That's when, we're going to have them in the office. We're going to have to give a cool down period. What we want to do is get to it before it happens. We want to prevent the meltdown from happening. So if you see a child getting ramped up, maybe in your class, maybe in an area that there is water available, give them some water. The water helps dissolve some of the cortisol in their body. It helps relieve that tension. It relaxes them. It cools them down. Have the child look up. In your brain, if you look up, when you look up in your brain, it shuts your emotions off. I have a big poster up on my roof in my office that has a little bitty kitten and a big tiger, and I say, what's that look like? And I make the kid describe it, and at first they can't think. And as they start looking up, their emotions shut off, then they can start describing that to me. Then I can start the conversation with the child. Allow time for the child to process. You can't ask them rapid fire questions. Answer me now. That's not working. All that's doing is triggering the child worse. Allow silence. Maybe the child just needs to stand over here to the side for a minute and just let him be quiet. Just let it calm down before you do anything. Respect this personal space. Don't get too close to the child. Keep your distance from the child. Number one, you don't know how the child's going to react. You don't know what traumas they've had and what they're going to do. So always protect yourself, but also keep your distance from the child. Don't get too close to them in their personal space. And then choose carefully on what you insist on. Don't make some type of outlandish statement. This is what's going to happen if you don't do this. Just be patient. Try to deal with the child. If you can't handle that situation, remain calm and then seek assistance for more help. Now, what does a trauma look like? Let's look at the brain here, and this is going to give you a really good picture of what a brain looks like. This is a 3-year-old children. The one on the left is a normal brain. You can see how large the brain is. You can see the dark spots in the middle of the brain. That's the part that controls emotion. It's kind of small. You look at the right side. This is extreme neglect. Look how large those black spots are in the middle of the brain. That part of the brain is overly developed. That is the fight or flight. That's the reaction emotion part of the brain. So you can see now why some children will throw temper tantrums more likely than others, because the frontal lobe is smaller, but the emotional part is much larger. So this is a child that's been traumatized. Now, look at the healthy versus the abused brain also. We just talked about the frontal lobe. If you can see the front part where it's really, really red, and then you can see on the right side where it's kind of green, but there's some little dark areas there. That means the frontal part's not working very well. They're not making those wise decisions. They're not making those healthy choices. You know, asking a kid, why did you do this? Instead of explain to me what happened, and explain some choices that you're making, that is starting to retrain that brain so that part of the brain develops. So how does it affect the children? Number one, you got to get to know your kids. I've seen all different teachers, all different types of drivers. I've seen aides. I've seen cafeteria workers. Some of them are really, really good at it, and some of them aren't so good at it. And we're here today to try to teach you why you need to be good at it and get to know your children. Well, number one, you look at your child in the eyes as they get on the bus every day. Every day I had a classroom teacher. They walked through the door, and I'd look them right in the eye, and I'd ask them, how are you doing today? I'd see that eye contact, because I could tell if that child was sleepy. Maybe they're having sleeping difficulties. You ask them, what's going on? Are you not sleeping? Are you staying up late? And get into that child's life a little bit. Maybe you can help give them some tips. Behavior that's impulsive. You know, a kid that just reacts out. Why does that kid reacting out? There's got to be a reason for it happening. Kids just don't react out. There's a reason for it. And it may be because of this abuse that's going on. Aggressiveness. Why is that child being aggressive? Especially in the little ones, you know, K, 1, 2, 3. Why are they being extremely aggressive? As they get older, they learn to monitor a little bit more. Sometimes middle school, we still have problems with that. But high school, they kind of get a little bit better at that. Physiological symptoms, medical issues, are they're being sick all the time. Sensory sensitivity. Some children are super sensitive to light. They're sensitive to the bells. We've changed our bells on our campus so that it doesn't trigger a child. And they go into, have a trigger and they just have a meltdown. Reckless risk-taking behavior. You hear kids talking about, I did this weekend. There's something going on while they're taking those risks. Disengagement from school. They don't care. Maybe there's bigger things like the 911 call. I'm not really cared about my math today because I'm worried about my daddy killing my mama. There's bigger things in their life. Poor social interactions, other medical issues, and learning problems. And we see that a lot because the brain's undeveloped. How does drama affect the learning? Well, number one, there's speech and language difficulties. You have a kid that's struggling in ELL or ELA, difficulty concentrating, lower academic achievement, lower test scores, more likely to drop out of school. And that's a big struggle because the kids feels hopeless. They can't do it. They just need that one little encouragement. You never know what that one word of encouragement is going to do for that child, to make them smile, to make them think someone cares about me. You may be that person that changes that child's life. Poor relationship with peers or teachers, more likely to repeat a grade, more likely to be placed in special education classes, suspended or expelled more often. I like to go back to the more likely to be placed in special education classes. The children's brain, and we're going to get to this in a minute, the children's brain is very elastic. They can grow with great nurturing from us. The children can grow out of this. They may not even need any of that assistance later on. Triggers. I've heard this word. I picked up this from my daughter that was in college, and she kept saying, I'm triggered. And I said, what are you talking about? And as we started investigating this program a little bit more, I think we all have triggers. I've probably seen some of you triggered driving down the road in traffic in 98 in Destin. So what are some of your traumatic experiences, and what triggers you and what triggers your children that you work with and interact every day? So reminders of the past traumatic experience automatically causes the body to react and tense up. If you're someone that you come to and you start raising your voice to a kid, well, if their dad's abusive and they smack them when they raise their voice, and you start raising your voice, it triggers that brain to shut off. The thinking's going to shut off, and they're going to react. They may pop off, say something, run away, or react to you. What might be some of these triggers? Loud noises, physical touch. There's some children, you can't touch children now, but I'm kind of a tactile guy, and I might say, hey, how you doing today? And you can see when they jerk away, that's a trigger. There's something going on in there. You can even watch them with other children. They really avoid that children on any touch at all. Routine changes. If you change a routine, maybe there's going to be a drill. If you're in a class with some students that have trauma, you go to your principal, you go to me, and you say, hey, I have this student in my class. Can you let me know when that drill is going to happen? Because you need to prep that child before that so that child doesn't have a meltdown. Or maybe you're going to be doing an evacuation drill on the bus that day. Let the child know in advance. Emergency personnel or vehicles. If you've had police officers come to the house or your house is burned down and firemen, they may react adversely to that SRO at your school. They may not react very well to that person. Confusion and chaotic environment, field days. We all know field days and pep rallies. They're my favorite time. Exactly, right? Because I'm going to be the one that gets all the discipline. That's when we have the most discipline, because these children that are traumatized, they don't know how to react in that environment. You may want to give them a safe place away from all that noise and chaotic experience. I sometimes let some of my students go to the media center, to the cafeteria during that time. Hands or body gestures. I talk with my hands a lot. When I'm with children, I have to kind of clasp my hands and I talk to them like this, because waving my hands may get a reaction thinking they're going to get hit. And now they're not listening to anything you say because their brain's shut off and all they're worried about is getting hit. And you're like, didn't you hear me? Well, no, they didn't hear you. They're not listening to you. They're worried about getting hit. Authority figures, as myself. SROs, lane uniform, we talked about that. How can I help? Now, this is what we really want to do. How can we help the children? What should we do? Number one, when we talk to a child, instead of saying, what's wrong with you? Ask them what happened. Ask them to explain that. That's going to get the thinking part of that brain going again. It's going to get them to relax, get their blood pressure down, and it's going to get them talking to you. And now you've disarmed them. And now you can get some productivity in correcting that behavior. Give the child some coping mechanism. Give them some tips. Give them some pointers. Find that person that's doing the same job you are doing, and they seem like they can always have good control of their classroom, good control of the bus, good control of the cafeteria, good control of the hallways, and you're watching them and go, they never have any problem with children. What do? Ask them for some tips. Go to your administrator, ask them for some tips. Survival techniques. What are some things that you can help them do? Hey, good proper nutrition, proper sleep, resiliency. Encourage the children to grow. Tell them they can do it. They will grow. They're resilient. They can grow a lot more than we can. I mean, just look at learning. They learn languages. They learn all this stuff that we have a hard time with as we get older. Ask yourself, is what I'm doing respectful and trauma informed? As I said before, they're not your child. Don't expect them to act like your child. I'm going to go off script here for just a second, but I had my son, when he was early age, we had a teacher wanted to say, you know, he eats like a mess. He's making a mess. He just throws his food everywhere. And I asked, I said, is he eating? And she said, yes. Well, she wanted him to get tested because she thought he was special needs. Now, he just started his second day of a clinical lab scientist job at Sacred Heart. So I don't think he was special needs. I think he was just a young man and he acted different than what she thought he should act as her child. So don't have those expectations of what they should act as your child. Take them as they come. Am I treating others the way I want to be treated? I've seen this before. Sometimes we try to be funny. Sometimes we try to build a relationship. We say something that's humorous. We try to something to the child. But sometimes it's embarrassing. I know that if I'm in front of a bunch of adults and I call out a certain person, maybe if I called out you right now, and I said something embarrassing in front of all your peers, how would you react? It wouldn't be funny. Well, it's not funny to the child either. So make sure that you treat them as you'd like to be treated. A dilemma. How do we know a child is suffering from a traumatic event? Symptoms that we can look for: ADHD, ODD, conduct disorder, etc. You can look at your children. As you talk to your children, you will start seeing things that are out of the norm with children. There's probably a reason why they're acting that way. They act a certain way for a reason. It's not just random. We do understand there are some children that do have bad behavior. We will deal with that on the discipline side of the house. But why are they acting that way, and how can we start trying to change that behavior to a positive behavior? How can you be a part of the solution? So how can we use those strategies to support those children, and how can it benefit the children? 6 principles from being trauma informed. Always empower the child, never disempower. Help the child grow. When a child comes in my office, I always allow them to speak. I give them the power to talk. Let them tell their story. That gives them power. Then they can identify with what was right and what they need to grow in. Provide unconditional positive regard. Find something positive to say every day. My favorite football coach I ever had, when I first started coaching, I went to him and I said, I loved you so much. I would do anything for you. How did you get me to do that? He said, I said something positive to every child every day. Now, if there's some children, it's hard to say something positive. Maybe you have to look down their sneakers and go, those are nice shoes today, because everything else is driving you crazy. But you can find something positive to say to that child. Maintain high expectations. We're not going to lower our expectations because of the trauma. We want to raise the expectations of what they should do so they can grow to those expectations. They may not reach all of them, but they can grow. Check your assumptions. Like I said before, don't assume they should act like this or they should act like that. Some children, they walk in, they look like they're to the nines, they're squared away, but they've got issues just like everybody else. No one has a perfect life. Everyone struggles. Observe and question. Put your eyes on and observe what's going on around you with these children. Be a relationship coach. Help the children grow. Help them deal with relationships. How should they deal with relationships? I mean, there's many adults that need this advice, don't they? So how can we deal with those relationships? You got to understand, when a kid's 10 years old at my school, I think their brain's really about 5. Because at 5 years old, how much did you really learn? So their brain's about 5 years old at a 10-year-old's age, and you're expecting them to act like a 30-year-old? It's not going to happen. You have to help them grow. Important things we can do. Make every student feel safe and secure. Every student at my school, I make a purpose to say, what do I do? What's my job? And they say, safety, Mr. Schroeder, to make us feel safe. So they know that I love them. They know that I'm going to make them feel safe. So even if I have to give them some discipline, they understand that. And many times, it's very strange, but many times they walk out of my office saying, thank you, Mr. Schroeder. And I just gave them 2 days of in-school suspension because they know I'm trying to help them grow. Create a positive classroom, school environment. Make a safe environment. That's one thing you can talk. Children should not be laughing at children. Make it safe. Let them know this is a safe spot. Do not tolerate the other children picking on a child or putting that child down. Make that a top priority. Teach older students about the impact of stress. You can logically talk to your students that are in middle school and high school and tell them what stress does, how you can affect it, maybe why they're not sleeping, maybe how they need to get off their electronics to help them cope and their brain grow better. Create relationship and connection. Connect with the children. You're the adult. You're not a child. Don't be the child. You're the adult, but you can be that loving, stable adult that kid knows that's a safe person. That's someone that cares about me. That's someone that wants to help me. Advocacy skills. Teach self-regulation, self-expression, and self-advocacy. This is the biggest thing I see our kids struggling right now is they want to run and tell someone. They don't want to deal with it. Teach the children how to stand up with. Tell that other child, I don't like that. I told you I don't like that. Stop. If you say it again, now I'm going to go tell an adult. Teach them to self-advocate. That teaches them to grow. That teaches the unwanted behavior to stop. And that teaches the other children that's improper and they shouldn't be doing that. So teach that. Maybe they're having a problem with the adult. How do they address the adult? Well, you don't do it in the middle of class, right in the middle of it, and start having a debate with the teacher. The teacher should say, Johnny, next time if you have an issue, at the end of class, when all the students leave, come up to me and let's talk about it. And that way you're teaching the child how to do it correctly. Support and develop constructive coping and interpersonal skills. Talk about those interpersonal skills. How can we deal with this? Especially with social media right now, it is very difficult. You have to inform the parents, first of all, because they don't know how the social media is impacting them. And you also have to inform their friends, and maybe they can work together. Ensure that shaming and humiliation does not occur. That is huge. One thing can label a child. I don't know if you can remember back to your middle school years. Think about in your mind about one embarrassing moment that you had to cope with maybe for months, maybe weeks, maybe years, and how that impacted you. Maybe something someone said about your haircut, maybe something someone said about your clothes, maybe something said about your teeth or the way you looked. And then you look at your high school picture and you're beautiful, but you still think you're that kind of awkward kid in middle school. Build resilience in children. Resilience. What is resilience? The ability to recover from a misfortune or change. How do you build that? Secure bond, we talked about that already. Relationship, positive relationship, we talked about that. Opportunities to learn. Opportunities to be a part of activities. Get students involved. Encourage them to be involved. It doesn't matter if it's a gaming club, maybe archery, maybe football, maybe cheerleading. Get involved in something at school. At Destin Middle School, I'm proud to say that we have about 550 of our 750 students actively involved in extracurricular activities. And you can see the difference that it makes in that child over the years. I had a student that when I first got him in 5th grade, he would bang his head on the desk repeatedly. In 6th grade, he'd bang his head on the desk. Now he's in 7th grade. We haven't had any issues with him. He's in archery. He's doing fabulous because he got involved, and our archery coach took a personal relationship with him, and he's doing fabulous. It's a success story. What's some practical suggestions? Maintain routines. You know, letting kids off the hook and not keeping a routine may seem like it's a good thing to do, but it's actually not a good thing. The same routine, constant, makes the child feel safe and secure. They know what to expect. Our kid's going to push you? Yes. Our kid's going to try to challenge you? Yes. But just stay with it. Increase the level of support and encouragement by designing designate an adult who can provide the support. Sometimes it's not me. Sometimes there's a child that comes to my office, they just don't click with me. I try to find someone else that they can click with. Maybe it's a female in the building. Maybe it's a male in the building. You can't relate to every child. You try to do your best, but there is someone that you can find to do that. It takes a little bit of time, but you can do that. 10-to-1 ratio of positive to negative statements. That takes work. You're either going to work on the front end or you're going to work on the back end. I'd rather work on the front end. I'm always trying to be out there proactive, talking to kids, relating to kids, so that on the back end, they're not having those meltdowns and I'm having to deal with that. And that's ruined their day and it's ruined everybody else's day. So be positive with those children. So when you do have to correct them, they're going to respond to that positively. Behavior plans and reward system. PBIS. Positive behavior system is what we need to develop. That is just like teaching math or English. We have to develop a system. I watch my bus drivers, and I have one particular bus driver that she's just fabulous, and everybody loves her. She deals with those kids. It's tough, but she has a system. She has a little reward system for those kids. She's working at the reward system. She works on the reward, and she doesn't have to work on the discipline as much because she's trained the children in the proper routines and the proper behaviors. I'd rather do that than work on the negative. Set clear, firm limits. There has to be limits. This is not a free pass. My beautiful bride is the mercy and I'm the truth in our relationship. So she balances me and I balance her. So there has to be clear-cut rules. You can do this and not do this, especially for safety. How do you approach it? How do you set it? How do you train the children to do it? Inappropriate behaviors and then the consequences, of course. Don't threaten. Do the plan. More suggestions. Be sensitive to potential triggers. If I have a student that I know has issues in my class and they come into my door and I look them in the eye and I say, how are you doing? I know something's going on. And they said, I've had a rough day. And I said, okay, maybe that day Johnny's going to go back in the back of the classroom and maybe I'm going to leave Johnny alone a little bit. I'm not going to be in his face. I'm not going to be all over his case. When everything's calmed down, then I'll go to the back of the room and I'll deal with Johnny. But I'm not going to call him out in front of everybody. Now all you did was trigger him. Warn the children if you're doing something different, out of the ordinary. Turn off the lights, making loud noises. Create a stable structure as much as possible. Use specific praise. This is very important. You did a great job paying attention. Now the child's going to think, I need to pay attention, instead of, you did a good job today. What does that mean anyways? So be specific. You did a great job staying in your seat. You did a great job raising your hand. You did a great job changing classes. I love the way when you disagreed with me, you waited to the end of the day to talk to me about it and didn't cause a disruption. You're training the children. I want you to watch this video. There's 2 ways to affect children. As you watch this video, which one are you going to be?
Hey, Mr. Q.
Did you see that? Why would somebody do that?
Please go into the classroom, no talking, quietly.
Hey, Miss Merida, how you doing?
We need you inside.
How do you think that makes us feel?
I forgot my number.
What's your name?
Jordan
What's your last name?
Carter.
All right. Go ahead.
School is hard enough.
Come on in, sit down quietly at your desks, and begin writing.
This kind of stuff just makes it harder.
I said quietly, please. Who's talking? Is it you, Sophie? Don't let it be you.
Don't believe me?
Sophie.
Please just watch.
I'm not up here for me, I'm up here for you. Pay attention. Okay? Now somebody answer me. Somebody needs to answer me really fast.
Every time we're ignored or yelled at or silenced, a teacher takes away what's possible.
No horseplay, no running, and especially no talking.
Moment by moment.
Miss McGarity, your student's behavior yesterday in the lunchroom, it was terrible. Next time, silent lunch.
Did you hear that? Stay in line and catch a bubble. I'm not playing.
If this is education, we're in trouble.
Bye, Miss McGarity.
Frederick Douglass said, once you learn to read, you'll be forever free. The way it is now, 2 of the 3 of us will never be able to really read. It doesn't have to be this way.
Hey, Jordan, how you doing? Good.
Everyone we meet throughout our day can make a difference.
I've been waiting for you to arrive.
All the difference.
Good, how are you?
Great.
Hi, Jordan. Bye, Jason.
Good morning, Jordan.
How are you?
I'm doing well. Thanks for asking. How are you?
Good.
Go ahead and put your number in.
Talk with us, not at us.
That's okay. I'll look it up for you. Go ahead, sweetheart.
Okay.
All right. Have a
Teach us what we need to know. That's how we get smarter.
Well, good morning, Sophie, Janicia, and Jordan.
And when you talk with us and teach us, give us bigger and bigger words.
Now what I'd like you to do, children, is turn around and converse with your neighbor and discuss where the mother might have gone.
Words that we can use to read and understand.
She is prey for eagles, so she hunts at night.
And that will take us places we can never reach without you.
Remember, we're entering the learning zone. Now, how can we show our respect to the children and teachers who are working?
We can walk quietly.
Yes. Okay, kids, so what I'd like you to do is continue writing your narrative, documenting your emotions if you were the baby owl and your mother abandoned you in the nest.
What can you do? Learn all that you can so that you can challenge us to be our best.
You would have stayed and assisted them in whatever they needed.
Share yourself with us and show us how to share ourselves with others. Give us courage. Give us compassion. Help us find our own voices so we can become who we are meant to be.
Why would you want to silence us?
Well, that's 2 stark contrasts on how you introduce and how you see a child every day. My question for you is, you have an opportunity to make a difference in a child's life every day, good or bad. What difference are you going to make? One last thought. It says, the kids who need the most love will ask for it in the most unloving ways. I want to thank you for investing in children, our greatest natural resource.
Thank you for participating in our discussion today. We wish you the best in your new career role with Okaloosa County School District. Thank you.